Dr. Gordon is a Canadian and US double board certified medical doctor, writer, speaker, publisher and researcher. She is a leading specialist in clinical cannabis medicine, and she maintains a virtual medicine consulting practice in Canada, but I believe you're now based in London, is that correct?
Yes.
She is also one of the youngest and first physicians to become board certified in Integrative Medicine, now recognized as an official medicine subspecialty through the American Board of Physician Specialists. Sorry, my eyes are not with me today. But Dr. Dani, thank you very much for stepping in at short notice, and I look forward to your talk.
Thank you very much. So I just got asked about 20 minutes ago if I could put something together, and I'm actually writing a book right now about cannabis and CBD, and I just finished writing the chapter on sex, libido, and cannabis, so I thought maybe that would be a topic that could wake everyone up before lunch. And it's a topic I get asked so often about, and it's something that everyone's interested in. Everyone talks about it in hushed tones, so I'm just going to be talking about what we know so far as the research, my personal experience using it in my medical practice, the experiences of my patients, and where we are hopefully going to go from here. So there was a big US study that was done with both men and women, and they were polled, and they found that cannabis users versus non-users had 20% more sex. So why is this the case? And when I talk to my patients who I'm treating with cannabis medicines, a lot of them have never tried cannabis in their life. They've never smoked cannabis. They've never tried it. And I'm not using it to help their libido primarily. I'm using it to help with their chronic pain, all kinds of other medical conditions. But oftentimes, they will often report back to me at future visits that they've just been having more sex, or it's been better. And I found that really interesting. We also know that a third of US women have tried cannabis for sex, and they report better orgasms. Sorry, that's a typo. I did these slides about 2 seconds ago. So again, we know it's a thing, but what do we actually know in the research? Well, cannabis and sex have a long history together. So there's been many cultures where cannabis products have been inhaled, vaporized, taken by mouth to use to either enhance sex and libido or to inhibit it. And it all comes down to that sweet spot of dosage, particularly with THC. For example, in India, where I've spent a lot of time studying traditional Ayurvedic, Indian herbal medicine and meditation, it's traditionally used by a lot of the Indian sadhus, the wandering ascetic yogic monks, to inhibit their sex drive when they are trying to put their energy towards different, more spiritual paths. By the same token, it can also be used at low and micro doses of THC and more CBD to potentially enhance libido. And, so yeah, it's all about the dose. And really, it comes down to the dose, particularly of THC. So at high doses, THC can actually delay orgasm in men. In women, we don't have the studies yet for that particular finding, but in men, we know it can delay orgasm. So if we're talking about someone who's suffering from sexual dysfunction, where delaying orgasm might be beneficial, might be desirable, that's a good thing. But it can also cause a problem if on the other end, if the orgasm is being delayed too much. So really, it's the sweet spot. And we're really only at the beginning of our research. So many of my patients who suffer with chronic pain, when I do their first consultation, oftentimes they come with their partner. Most of my patients, over half of them are over the age of 55. And, sex is not something they usually talk about with their doctor, but a lot of times, maybe because I do integrative medicine and I talk openly about everything with my patients, they sometimes, will tell me, or the partner will say that, their sex life has really been affected by their medical conditions on many levels. They're fatigued, they're in pain, their pelvis is tight, they have muscle spasm. There's all kinds of reasons why sex can be affected. And one of the interesting things I find is when these patients start getting better and their symptoms start getting better controlled, they also find that they can use some of their medical cannabis to help their libido and to improve their sex life. And this makes a huge difference in quality of life. And I find this so important because for me, cannabis medicine is a quality of life medication. And in integrated medicine, it's not just about curing someone, and we can't always cure people in medicine. I'd love to be able to offer all of my patients a cure, but for most chronic diseases, we're not there yet. So what can I do? Well, we can always, I feel, no matter what stage of life someone's at or what stage of illness, improve someone's quality of life. And sex in cannabis is one way that I have found that you can possibly do this for people. So how does cannabis help with sex? And in Canada, I treat people with THC, cannabis, and CBD. So there's always a little bit of THC involved. But even CBD, even from CBD wellness products, they can reduce anxiety. They can reduce stress. They can maybe reduce fatigue in some people. And all of these things put our nervous system into a more receptive language, so we can, be in the mood for things like sex, and our libido is better. Because if we're stressed, anxious, burned out, that is not a recipe for having sex at all, let alone good sex. So I find that even CBD, if you're in the UK and you don't have a prescription for cannabis, which is extremely hard to come by at the moment, something I'm hoping to change with many of my colleagues here. But in the meantime, we have CBD products. And CBD products combined with other herbals, combined with other techniques, can be a good tool for the things that I call flow blockers or sex blockers, like these things. So what about the research? And as I said, because this talk was done in about 2 seconds, I'm going to have some notes here. So we do know that low dose cannabinoids can enhance the sexual experience. And a lot of this data is from people's self-report, meaning they poll people who've been using cannabis in medical cannabis clinics. This is not recreational users. And they ask them about sex, like how is their sex life? How is their libido? How is their sexual experience? Do they feel pleasure? How are their orgasms? All of these things. And they find that at low doses, it can really help. At higher doses, it can actually impede sex for many people. And every person has a different sweet spot when it comes to when cannabis might be helpful or when it might work against you, because our endocannabinoid system, our natural system that interacts with the cannabis plant, is slightly different in each of us. So we're all a little bit unique, and these factors all play a role. Let's see. So actually, I'm going to talk about that on the next slide. Hold on. There we go. The endocannabinoid system and orgasm. So we actually do have some preliminary evidence that the endocannabinoid system gets involved in the big moment of orgasm, and that we release a burst of endocannabinoids, these natural cannabis molecules that our body and brain make naturally after we have an orgasm. So that post kind of glow phase after orgasm, when my patients ask me about that, I get asked lots of these questions when I do women's health. What causes that really nice feeling? Well, there's lots of brain chemicals involved. There's oxytocin, there's serotonin, and there's also endocannabinoids. So our endocannabinoid system really does get involved. And actually, we also know, because the endocannabinoid system is involved in everything that we call eat, sleep, relax, protect, forget. So if you can't forget about your problems, you're stressed, you're worried, that's not a recipe for good sex. So if your endocannabinoid system is dysfunctional, that is often a recipe for sexual dysfunction as well. So there's lots of ways that cannabis and CBD may help with the sexual experience. THC and blood flow. There's also some very preliminary evidence. There's a lot of these topicals out there right now for sex from cannabis. There's CBD lubricants. There's CBD topicals in the States and Canada. There's THC topicals. There's not really any published evidence that how they work yet. It doesn't mean that they don't work. It just means we don't know. However, there are some potential mechanisms, potential ways that it is working. So THC, when you put it on topically, it interacts with these special TRP channels, these voltage-gated channels. Basically, it doesn't really matter, but it's this thing that's a receptor in your skin that may actually release something called nitrous oxide, which is a blood vessel dilator. So in English, what this means is topical THC may be CBD, but we don't really know, may dilate blood vessels in the skin, in the genital area. So that's a hypothesis. We need to test that, to make sure we're correct. But preliminary evidence suggests this might be what's going on. A lot of my patients in Canada report using these products and saying that they have a better sense, it enhances their sensation, enhances their pleasure. If you look online, there's many blog posts now entitled, "Can you get your vagina high?" And these are the kinds of things that people are interested in. And in a medical context, it's always something we don't want to talk about. But I think it's extremely important because it's a part of normal function, and sexual function is just so important. Okay, so what about cannabis and fertility? So this is a really tricky topic. In men, we have a little bit more research than in women, which is a bit ironic, but anyways, that's where we're at. In men, so far, a few studies have found that high-dose THC, chronic use of THC smoked, may lower sperm counts, may lower sperm function, but then there's other studies that have not found that connection. So we still don't really know, but when I'm counseling men who are trying to conceive with a partner, I do tell them about that as a potential concern if they're within those childbearing years and they're actively trying to conceive. I've done a few sperm counts and sperm function tests on a few of my patients who have been chronic users, and they came back normal. So it's a small sample, but the question, the answer is we don't know. When it comes to women, we have mixed results again, and it's very preliminary evidence, and a lot of it is in rats, female rats, and one study in cows. So it doesn't always translate into humans. But what we know for those animal studies so far is, in one human study as well, that high-dose THC chronically, like smoking every day or using even medical cannabis vaporized or by oil every day with high THC, may shorten the second half of the menstrual cycle. It's called the luteal phase of the menstrual cycle, and it may lower something called progesterone. So progesterone is a hormone, without getting too technical, that we need, like let's say you're trying to conceive. So if the progesterone is too low and other things are kind of lowering the progesterone, this is a hormone that we need to help incubate an egg and make sure if an egg gets fertilized and it's in the womb, that it goes on to have a pregnancy. That being said, there's many other things that reduce progesterone, like stress. Stress reduces progesterone probably more than THC, but we don't know for sure. So again, if I have a patient who's actively trying to conceive, especially if they're 35 or over, if they've been told that they have fertility issues in them or in their partner, then I'm really, really cautious with THC. And we have that conversation because we really just don't know how much it might play a role at this point. Oh, that's the end. So guys, thank you so much, and I'm sorry that was short, but I'll take any questions related to women's health, sexual health, and cannabis if you guys have any questions, and then I'll see you back here, I guess in an hour for our medical panel.
Thank you very much, Dani. Do we have any questions? Come on, there's got to be one brave soul out there. Here we go.
Thank you very much, Doctor. I enjoyed everything you had to say. I'm from a national newspaper who have a very healthy interest in adult phones. We're from the Daily Sport and Sunday Sport. Do you think there will ever be a male Viagra product from CBD? Thank you.
Yeah. It's a great question. I get asked this a lot as well. So, people ask me all the time, is CBD the new wine and Viagra? The answer is we just don't know, but it's, CBD may not dilate the blood vessels the same way as THC can, and the topical absorption of THC isn't great to begin with, but you can do things to increase how much THC gets absorbed through the skin. So I think in the future, THC containing products topically may be more beneficial for blood flow, which is what Viagra is doing, than just CBD alone. But I think we need more research. Yeah. Another brave soul over here.
Do you think the legislation will change once more research is done to find out the health benefits? I know you guys as doctors are quite apprehensive to prescribe it to patients because you haven't had the right training. And are there people now coming in to sort of train you guys up? You know, clinics in Europe are all prescribing it for medical reasons.
So
do you think it will change?
Yes, so in Canada, I've prescribed it for thousands of patients. And I'm here training the UK physicians, working with other physicians. So that's been my primary role in the UK, working with government, working with UK physicians. I'm the vice chair of the Medical Cannabis Clinicians Society. I mentor physicians. So yes, I do believe in it. I'm not apprehensive. I've treated thousands of people. And so far, the reception in the UK has been warm, but doctors want to help their patients and they're interested, but they're concerned about what the colleges are going to think. Is it legal? And then how to actually get the product to the patient has been the challenges we're now facing. But I think it is going to change, similar to what happened in Canada. When I first started prescribing in Canada, I was already prescribing other herbal medicines along with my conventional medicine drugs. This is the last herbal medicine to add on. The reason why was I knew about cannabis. I was trained in herbal medicine, so I knew how to use it. But I was worried the same thing as people are worried about here now. The colleges were saying, don't do it, even though it was perfectly legal. We never learned about it in medical school, and there was a lot of stigma. So, what I always tell people is, in Canada, it's been legal for medical use since 2001. We've had 20 years. So what I see happening in the UK is positive because I see things moving faster than what we had in Canada, even though it may not seem that way right now, but it actually is moving at quite a fast pace. I'd like to see it move faster personally, but I think we're moving slowly in the right direction. Yeah.
Hi. What's your view with alcohol and CBD being mixed together? We've got a lot of alcohol companies approaching us to add CBD to their products, and it'd be nice to hear your view.
Yeah, it's another great question. So I think as a society, we're moving more away from alcohol, which is why things like CBD dinner parties and CBD mocktails are really popping up. I think adding CBD to alcohol, we don't know the exact way that's going to, I don't think it's going to have a bad effect, let's put it that way, because alcohol, it is a mild poison to the brain and to the body. Cannabis, even THC, can be neuroprotective, meaning brain protective. Alcohol is not, even at low doses. That being said, it's the most socially acceptable social lubricant that we have, especially here in the UK. So I think alcohol companies are smart to start shifting away from just alcohol, and maybe now we'll see them adding it in, and maybe eventually, especially with the millennial demographic, they don't want to drink at all, a lot of the millennials. So I think we're going to see more shifting away, maybe even to moving into just CBD and other botanicals and cannabinoids in drinks, maybe replacing alcohol eventually. Yeah.
I think we have time for one more quick question if there's one out there. Anybody? Okay, Dr. Dani, thank you.
I think we have one more.
Hello.
Hello.
Do you prescribe? Do you just prescribe it along with your normal medical drugs to your patients for epilepsy?
Yes. So my practice, I span all of the specialties. I have a referral practice where, because I specialize in integrative medicine and cannabis medicine, I work with people with epilepsy, chronic fatigue, fibromyalgia, neurological diseases, like the whole gamut, mental health. So I do have some experience with epilepsy, but in my medical practice, I only treat adults. I don't treat children. I've consulted on a few pediatric cases here because there's not a lot of other people doing it so far here, but yes, so a lot of my patients in Canada still need some anti-epileptics, but they're able to come down quite a lot on their dosages, and the quality of life improvements I've seen. Like I had one young gentleman, he was 25, and he was completely unable to function because he had such severe epilepsy that it caused brain damage over his lifetime. So far, he was on such high doses of anti-seizure drugs that they were basically turning him into a zombie. And in a year, putting him on cannabis, he went down to the lowest dose of just 2 of those medications instead of 5. And his quality of life improved so much that he was speaking and interacting normally. When I first met him, he couldn't even verbalize with me. So it was such an immense change. And that was one of my earliest cases with cannabis and epilepsy. And it made me such a believer because I couldn't believe that, he he went from being told that he would have to live in an institution the rest of his life to having his own apartment, getting a part-time job. He was able to get a dog. Like, his whole life changed. So I'm, big believer.
Okay, Dr. Dani, thank you very much.
Thank you.